Okay, there's a lot of discussion that goes on when we start talking about chemotherapy. Over the years, it has been our position and at doctor's direction and conversations that if someone is receiving chemotherapy, we typically wait until after the chemo has been administered, and typically 24, 48 hours after the last session, things are kind of moved through the body and you can begin to treat. The reason we haven't treated is because it can improve the metabolization, and if someone gets ill feeling with their chemo, that can be enhanced a little bit if PEMF is taking place at the same time. Now, there's a whole movement and a whole discussion by some doctors where, and it makes sense, but they talk about using PEMF during the process of chemotherapy. Now, that's where you would have these conversations with the doctor, with the patient, with the client that you're talking to as to what is best, and it certainly operate within the guidelines that a doctor would give. On the side of precaution, and we always err on the side of precaution or on the side of comfort, I would say that once chemo is completed, wait 24 to 48 hours, and then you can begin treatments right up until the time of another round of chemo or whatever the process may be at that point. But as I said, there are some doctors that are saying, and I do know that there are in outside of the country and in other places where they are doing this, in many cases they're giving less chemo using PEMF at the same time to not have to put as much poison or much of that product that what people refer to as poison in the body to attack the cancer type situation that they're dealing with. So there's a lot to discuss there and a lot to have conversations with your doctor.